Hello, we are a group of students from the Bruins Public Health Research Committee, and we are excited to present our study titled The Language of Care, a Geospatial Analysis of Chinese Language Accessibility in LA County Substance Abuse Treatment Centers. Our presenters include Luna, Annie, Miah, Catherine, and Nina. We would also like to acknowledge and extend our gratitude to Cindy Pang, our graduate student mentor from the Fielding School of Public Health. Now I'll pass it on to Nina to provide some context on this study.
As a whole, the United States is made up of residents from a wide range of cultural and social backgrounds, and this is particularly true for California, where many citizens are bilingual or may not be entirely fluent in English. This poses language barriers for many minority groups, which has a strong impact in fields like healthcare. Given the need for clear patient-provider communication towards ensuring a high quality of care and maintaining trust between patients and physicians, language accessibility is a key focus of health disparity efforts and public health work. In Los Angeles County specifically, over 50% of residents speak a second language at home, which means that ensuring accessibility and inclusion in healthcare by mitigating language barriers and increasing geographic convenience, which refers to aspects like travel distances to treatment centers, has become more and more important. One area where these efforts need to be examined is in the treatment of substance use disorders, where lowering obstacles to care can substantially improve patient recovery outcomes and their likelihood to take the first step of seeking medical treatment. And now I'd like to pass it over to Miah to talk about how this applies to our study in particular.
Thank you, Nina. In Los Angeles County, Asian Americans are the fastest growing minority group, with Chinese Americans as the largest ethnic subgroup. However, Asian Americans have consistently been found to underutilize substance use treatment services, particularly due to cultural, linguistic, and geographical barriers. In addition, we noticed that existing studies have focused on analyzing Spanish-speaking populations in LA County and their proximity to linguistically accessible treatment services, but similar needs have not been explored for Chinese-speaking communities, leaving a gap in understanding potential cold spots. This is what led us to conceptualize our current study, in which we use GIS, or Geographic Information Systems, to identify potential cold spots in LA County, consisting of areas with high concentrations of Chinese speakers but low geographic areas to treatment services that offered Chinese language support. We then examined if these cold spots also aligned with high overdose mortality rates to assess if greater treatment services were actually needed within these areas. And throughout this process, our overarching goal was to inform equitable, linguistically accessible substance use treatment planning for LA County's multicultural communities. And now I'll pass it on to Catherine.
Thanks, Miah. So for our methods, we first processed data from the 2020 US Census and calculated the percentage of Chinese speakers in each LA County census tract. And in order to identify the treatment centers to include, we filtered for facilities under the categories of substance abuse, buprenorphine practitioners, and opioid treatment programs. We also selected the category of any Chinese language. And these filter options resulted in 65 treatment centers. And in order to verify that the centers actually had a system in place to provide a translator if needed, we called each center, and that narrowed down that list to 12 facilities. We then mapped the LA County census tracts and the locations of these 12 treatment centers to start our spatial overlay analysis. We defined cold spots as census tracts with high percentages of Chinese speakers and longer distances from the nearest treatment center. We then determined the thresholds of both of these variables by calculating the 95th percentile, which are listed here. And after this analysis, we wanted to check the overdose mortality rates that were reported by the LA County Department of Public Health in the cold spots that we identified. And from there, we assessed how great the need is for additional treatment centers in these cold spot areas or within the Chinese American population in general. I'll pass it on to Annie, who will give us a rundown of our results.
Thank you, Catherine. We mapped on R the census tracts along with their Chinese-speaking population percentage, which is color-coded in blue. The black triangles represent the locations of the treatment facilities. East Los Angeles County, including areas such as Diamond Bar, had higher percentages of Chinese speakers of up to over 50%. And I'll pass it on to Luna.
Moving on to the analysis, we looked at the association between the proportion of Chinese speakers within the census district and the distance to nearest facility center that offers Chinese-speaking treatment. As we can see from the graph, most of the census tract that has a high proportion of Chinese speakers are relatively close to the nearest facility center offering language support, which is below the threshold line of 8,000 meters, translating to around 10 to 15 minutes by driving. However, looking more closely into the intersection of the two threshold lines, next slide, please, we were able to identify these 14 census tracts as a potential cold spots. And looking at these cold spots more in geographically, we overlaid these districts onto the LA census tract map. Next slide, please. And we found that it was clustered into 3 major areas, which includes Diamond Bar, Walnut, Monterey Park, and Palos Verdes area. Next slide, please. And these were the summary statistics for the 3 districts. However, these are only potential cold spots, meaning we still needed to investigate if the drug overdose mortality is a substantial problem within this district. So we looked into another data set to look at the association between the percentage of Asian population and drug overdose mortality rate. And running a simple linear regression model, we found that statistically significant negative association between the percentage of Asian population within the district and the drug overdose mortality rate, with the slope being negative 0.115 and the 95% confidence interval falling within the negative range. This suggests that each percentage increase in Asian population leads to less cases of drug overdose death. Now I'll pass it on to Annie.
Here, we focus on areas with particularly high Asian population percentages, over 50% in all the districts shown in the table. Interestingly, most of these areas had NA values for overdose mortality, which, according to the department's reporting standards, indicates fewer than 11 total overdose deaths. This threshold is used to preserve privacy and reliability when counts are very low. The only exceptions were Roland Heights and Monterey Park, which had reported overdose mortality rates of 9.5% and 8.9% respectively. These values were below the mean rate of 14.5%. Palos Verdes also had an NA value for overdose mortality rate. This pattern suggests that areas with large Asian populations tend to have very low recorded overdose mortality. Next slide, please. Our cold spots do not correspond with high overdose mortality rates, suggesting that there is limited immediate need for additional treatment facilities in these regions. But we have some limitations.
Yes, so the first limitation is how comprehensive our list of treatment centers is, and we only depended on the SAMHSA treatment locator. And although it's run by a US federal agency and updates facility data annually, it's still possible that we're missing some treatment centers in LA County that do provide Chinese language support. Additionally, the Chinese speaker data we got from the census does not give enough details about the level of fluency, and it's possible that even though a census tract has a high percentage of Chinese speakers, the population is also comfortable enough using English to get access to substance abuse treatment. There's also different Chinese languages within Chinese itself, such as Cantonese, and those specifics were also not mentioned in the SAMHSA treatment locator. Next, substance use is a term that covers a lot of behaviors and treatments, which presents another limitation in our study when we're trying to define substance use treatment facility, and our definition may not fully capture the diversity of treatment options available, which potentially oversimplifies the landscape of substance use treatment resources in LA County.
Next, the distances we calculated are straight line distances between each area and the nearest treatment facility. This does not account for real-world travel conditions, such as available transportation modes and traffic patterns, all of which could significantly affect actual access. Also, the overdose mortality data we use reflects rates for the broader Asian American population, not specifically Chinese speakers. Given the diversity within Asian American populations, these subgroup differences could cause different substance use outcomes and access to care. Another limitation is that overdose mortality rates should not be taken as a direct indicator of adequate access to care, as they represent just one outcome and do not capture the broader range of factors influencing health outcomes. Although these limitations may affect the precision of our findings, they provide important context for interpretation. Nonetheless, our analysis suggests that areas with limited access to treatment services do not currently exhibit high overdose mortality, indicating limited immediate need for additional services. These are references. Thank you.